Thanks for staying with us on News at Prime. Now, in the past 2 years, we have learnt a lot about the COVID-19 pandemic as the medical fraternity learns more about the virus. The recommendations for prevention and treatment also evolve. One of the guidelines that has seen a drastic change is the prevention of COVID-19 in pregnant women, who are now encouraged to get vaccinated. Although they are not at higher risk of contracting COVID-19, data suggests they are more likely to face complications. For more on this, I'm joined by Associate Professor in Paediatrics at the University of Pretoria, Professor Ute Feucht. Very good evening to you. Thank you so much for joining us. The effects of the COVID-19 pandemic have been devastating, and now pregnant women also need to ensure even more caution.
Yes, good evening. That's absolutely correct. We have seen the last 2 years, it's really been difficult, obviously, for everybody. But pregnant women and women with newborns and small children have especially been hard hit. And pregnant women, in our country, we had, before the COVID pandemic, we had seen our maternal mortality, for instance, come down over the last few years. And although we knew we still had a way to go, we were very happy that the maternal mortality was coming down. And then COVID-19 came, and we have seen in the last 2 years that the maternal mortality rate in South Africa actually increased again, sadly. So it's been especially true in the second and the third waves. The fourth wave was better, but it is really important that women get vaccinated during pregnancy so that they are safe, and that vaccination also protects the newborn baby from disease.
So at what stage of pregnancy is then vaccination encouraged?
So actually we are including vaccination during the routine antenatal visits. So, and there's no contraindication at which stage. So the earlier the better, because we want the woman to be protected. And as I said, actually, if she then also has her full vaccination, then the baby is even more protected. The mother's antibodies cross the placenta, and they also cross through the mother's milk after birth, and then the baby gets antibodies, because as you would know, we can't vaccinate the babies, but the babies basically get sort of vaccinated through the mother's vaccination.
Professor, with the information evolving as more and more research is done and conducted, what are the big differences between what we knew then around pregnant women and the vaccine, as well as COVID-19, and what we know now and need to really pay a lot of attention to?
Yeah. So initially, obviously, this was a new disease, and we all had to learn, we had to guess which risk factors there would be. So pregnant women are usually obviously younger. We knew very early on in COVID-19 that the older people and people with comorbidities were more at risk of dying, unfortunately, from this disease. But pregnant women turned out to be a risk factor as well, and especially if they also had comorbidities, like if they also had hypertension or diabetes. So we now know that we need to be very careful when we care for pregnant women, because they do actually have an increased risk if they contract COVID. The other thing that we sadly learned is that COVID disrupted our health services, and women were not always able to access antenatal care. They had sometimes got issues accessing delivery care, and sometimes mothers and babies were separated from each other after delivery. For instance, if the mother had COVID and the baby was ill and needed to be in a neonatal unit or in the kangaroo mother care unit, this was a problem, because we couldn't, you can't have an actively infected COVID-positive mother within a setting where there are other mothers and babies. Yeah, so this is what we had to deal with in the last 2 years. What this new guideline actually does, that was released from the Department of Health now very recently, is to try and normalize the care, integrate COVID care into our normal routine health care for mothers and babies. As knowing that it's an infectious disease and it's an airborne disease, so infection prevention and control is crucial. But actually, so is it for other diseases like tuberculosis or RSV. These are other airborne diseases that also can be spread within the hospital setting. And we need to be vigilant with our infection prevention and control. But at the same time, we're trying not to harm mothers and babies unnecessarily by, for instance, separating the mother and the baby unnecessarily from each other, because then the mother has issues in terms of bonding with the baby and in terms of breastfeeding and all of those other sort of normal, healthy things that need to happen after birth.
So what sort of myths do you think need to be dispelled at this stage, Professor, especially with the new information showing that pregnant women are at a higher risk of severe COVID-19 disease? And this information speaks to more especially in the case where they're in the last 12 weeks of pregnancy, and, which is something also very concerning.
Mm-hmm. So it is important for all of us to get vaccinated against COVID-19, but it's more important for pregnant women. So they are a risk group, and they should know that. And obviously, life goes on. We are now 2 years into this pandemic. We are in a different situation now than what we were 2 years ago. Firstly, because we now know more about this disease, and also because the majority of South Africans actually have had some contact with this new disease, either because we were infected or because we got vaccinated, or the combination of the two. So and we have seen with the Omicron virus, it's become more infectious, maybe. But the last wave, the fourth wave, was certainly, we had fewer mortalities, and also in the pregnant women. So it was reassuring that the immunity in the population is also assisting in making this a less deadly disease. But still, vaccination in pregnancy is safe, and it really is important for women to get vaccinated for themselves, and as I said, also actually for their babies, because we can't vaccinate newborns at this stage. There's no licensed vaccine. So it is the mother's vaccination that actually protects both of them, and it is a safe thing for her to do.
I suppose when it comes to dispelling some of the myths, Professor, or the notion or thought process that one would have around a pregnant woman who takes multivitamins on a daily basis and omegas and so forth, that they would have a more resistant immune system when it comes to the high intake and taking extra care of yourself during this period.
Yeah, so actually the reverse is true, because pregnancy is actually an immunosuppressive state. So because the mother's body is suppressing some of the components of the immunity in order not to reject the fetus, the unborn baby. So pregnant women are at risk of infections, also because later on, obviously, the abdomen becomes very big, and so it presses on the lungs and all of those types of things. So pregnant women pregnancy is obviously a very normal part of life, but it is also an at-risk period, and that's why we have special care and extra vigilant care anyway during that time period. And if one is in the middle of a pandemic, like we are still, then we need to weigh the extra risks, in this case of the COVID, on the pregnant women.
The pandemic also resulted in many women giving birth without their partners because they weren't allowed visitors. Has any research been done to see if there was perhaps an increase in postpartum depression? Yeah,
so that's very true. Women were marginalized. They were admitted to hospital wards for their deliveries. They were tested for COVID. Some of them tested then positive, and then they had to have their babies with the health workers in full PPE. So that human contact really was problematic, and then they weren't able to, in those type of cases, to have birth companions and visitors, and that really is a problem. And we need to normalize that. We need to come back and find our humanness, our humanity again, within the healthcare sector. Because obviously there were reasons why in a pandemic with a highly infectious pathogen, we had to have extra precautions. But we need to take stock of what that actually does to the mental well-being of the women who are involved. Yes.
Absolutely. Thank you so much for that discussion. Associate Professor in Paediatrics at the University of Pretoria, Professor Ute Feucht. They're speaking to some important information. If you are pregnant or know of anyone who is pregnant, encourage them to get vaccinated.